Tomorrow, you got two today. Get one more.
Hey, Miss Glendine. Hey, Lady Charisma. How are you? Let me jump on. Let a few more people come in, and then I'm gonna go ahead and go through real quick. Hey, Suke. How are you? Hey, Adana. I'm all right, y'all. I'm not the best, um, but hey, I said I was gonna do this live, so I want to go ahead and get this taken care of. Daylan, Daylan, come here. Never mind. Cut that light on, Olo. Never mind. Okay, go sit down. Thank you, Miss Glendine. All right, y'all. So I did say that I was gonna be come through and just do like a quick little breakdown about the Medicare and everything for just to give some little information, little insight, hopefully to help a lot of people understand like the basics of how um, Medicare works. So that's what I definitely wanted to do. Thank you, Trey Trey. How are you? Hey, In the Know with Glow. Thank you, Suke. So just basically what I did want to go through. Um, what I did have all of this set up. So basically, for I know most people do know, they don't know. So what is Medicare Medicare. Medicare is a federal system of health insurance for people over the age of 65 years of age and for certain younger people with disability. Now, there is a lot of different disabilities that a person can have that can qualify them to be able um, to qualify for Medicare. Now, as you see, they are like different parts of Medicare. You have Part A, you have Part B, you have Part C, you have Part D. Part A of Medicare is going to take care of your um, hospital services, like anytime you go to the hospital. Part B would be like the medical part, which would be going to the doctor's office and needing to be seen. Part C is considered the Medicare Advantage part of Medicare. And then you have Part D, which is also going to be your prescription drug plan. Now, when you become eligible, um, so basically, it's just like how does all of this work um, for an individual who needs to qualify for it, whether it is um, for a disability or they are aging into it and being able to take care of it. Um, so the Part A and the Part B is considered to be original Medicare. With original Medicare, you would be able to get what is an standalone prescription drug plan. That would be going with the original Medicare. Now you have your Part C, which is going to be Medicare Advantage plans. Now, if you choose like the Medicare Advantage plans, those plans include your Part A, B, and your Part D. Now, you do also have the option to have what is called supplemental coverage. With the supplemental coverage, that would be considered like Medigap. The only way you would be able to get, you wouldn't have the Part C, which is considering Part C would be is the Medicare Advantage. Now, with Medicare Advantage, that does also include like the dental and the vision plans, which are Part C. Keep in mind when you just have your original Medicare, that only covers your doctor, your hospital, and your prescriptions. You don't get anything, no dental, you don't get any vision or any of that included when you are with original Medicare. That is only included when you have your uh, Medicare Advantage plans. Okay, so when you are with Medicare, some people do qualify to have Medicare and Medicaid together. If you have Medicare and Medicaid, Medicare is going to pay 80% of the cost and Medicaid would pay 20%. So say if you go to the doctor and you only have Medicare, keep in mind they are only going to pay 80% of the cost. So that other 20, a lot of people have the with the VA benefits because keep in mind that just because you turn 65, they will try to tell you to go ahead and enroll into a care plan once you become eligible and you are on VA. That is only because your VA benefits is only going to cover the services that are provided at the VA clinic. So if you go to and doctor or a hospital that is outside of the VA clinic, your VA benefits won't cover that. So you would need to have your Medicare to be able to cover those. Because keep in mind, VA is only going to cover the services that are provided at the clinic only. Um, and your Medicare will cover services not done by the VA. So I want to go over that. So with the Medigap, let me go to the comments and make sure. I do want to definitely make sure I don't miss nobody coming either. So I spoke, hey Angel Mom, how are you? I do see you came in. Suitcase, they just started with Medicare last year. Okay. Um, Everybody is speaking. Hey TC. My condolences and prayers goes out to you and your family. Thank you so much. Thank you, Angel Mom. Hey, I'm living my life like it's golden, and thank you. Hey, Miss Wanda, thank you. Hey, Tawana, thank you so much. Hey, Real Love, thanks, Real. This is some good information. Yes, ma'am. I supposed to been came out here and gave this, so I definitely wanted to go ahead and go through it with and just go ahead and do it. I wasn't doing nothing else, and I said let me go ahead and pull this out and do it. Hey, Belladonna, thanks, love. Um, Let me see what I was gonna say. So let me just go into. She say I need to hear this. Okay, so now, certain states, now I'm not going to say all states, but keep in mind certain states you are able to get, when I did mention the Medicare supplement insurance, better known as Medigap, some states you are able to get Medigap, and I'm going to break down the different parts of the Medigap because Medigap, you have a plan F, G, K, L, M, N. So it's a couple of parts with the Medigap and everything like that. So I'm gonna go through some of that and it, go through that too. Um, so basically, so I did say how the Medicare Advantages work. Those include everything. Now I don't know if it's gonna change for the new year yet, but I do know right now a lot of the Medicare Advantages plans they do have those plans that have like a $0 premium, or you may have to pay all a part of your premium. A lot of those premiums I know for these standalone plans, when it's coming down to like the prescription drug plans and stuff, those plans are coming in as being like cheap this year. They are really cheap. I know for sure like WellCare here in Georgia, a WellCare Medicare plan for just prescription drug plans, those was like 50 cents this year, just for a drug plan. Some states had a $0 copay for that. Now, I do want to let y'all know too, when you become eligible for Medicare, Part A is included. Part B, depending on your income, you may have to pay for your Part B. Depending on your income, depending on your circumstances, you may have to actually pay for your Part B coverage, which keep in mind, Part B is when you are going to your doctor's office. So depending on the financial status of you, you would may have to pay for your Part B. I know Part B is probably running, it depends. I know for some people, I know at first mine was like $144 that they was taking each month from my SSI check, and then it went down to where they was covering the full thing. So it's definitely going to be based on the circumstances. And I'm gonna tell you now, if you are working, you're gonna have to pay your own premium. They're not gonna cover your Part B. You're gonna be paying your Part B if you have a job. Off rip, they're not gonna. You're gonna receive a letter. We're not gonna be able to cover this. You're gonna be responsible for this amount, and they're gonna tell you the amount that you'll have to pay. When you become eligible for Medicare, you do have a 60-day. I think it's 60 days when you become sick, when you're turning 65, you have a 90-day window before your birthday where you can start applying and getting everything set up for your 65th birthday. Now, as far as your prescription drug plans go, Okay, Suke say $174 a month for her. Okay. Hey, no more drama. Thank you, Miss Cynthia. Hey, Miss Anlo. So for your prescription drug plans, I am definitely going to tell y'all 100% to definitely research your drug plans and do not. I know everybody first place that they want to run to is going to be Medicare.gov to actually see about the cost of the medications and to like try to compare like different plans and stuff. I would advise you not to go to Medicare.gov because that the information there never be the same information as going to the company's website and doing your research there. Now, when you go to a company's website, let me see. Hold on, y'all. Let me see if I can do this one. I put the website in wrong. I'm gonna be able to type one day, y'all. Okay. Did I do the wrong one? Okay, no, it's right. Okay, so as you see, now I gotta go back to my live screen and let me share this other window. Give me just a moment. Okay, so here I'm gonna go to the WellCare website. So this is basically what a WellCare website. This is basically when you go to any plan, you would go to their plan, and of course you're just wanting to check out their plans and see what they have. You always want to go make sure you get over to Georgia, and then it's asking you what do you want to do. You want to go ahead and compare plans, and then you can enter your zip, and you don't really have a specific pharmacy. um this is the one I wanted. Oh, yes, it is. You don't have a prescription. Do you have any prescription drugs? Now, you can put your list of medications in here if you want to, just to play around to get a better list of your medications. It will also let you know if you put your medications in here, it's going to let you know if it's covered or not. When you go to this part and you put in that, it's going to ask you if you want to know a specific doctor, but here we're just going to be checking for your prescription drug coverage. So you can say no about the doctor, and then it's going to pull up the plans and what you want to make sure, because as you see, this is trying to give me the Medicare Advantage, but we don't want Medicare. As you see, it'll give you the Medicare, those $0 copays. And then when you get down to a lot of these other plans, which is these would be like the AMO and PPO plans. So you would want to go here and switch over to prescription drug plan. And this would be the standalone drug plan. So this here plan is would be I know WellCare has like three plans right now, which is the Value Script Classic and the Value Plus plan. The Value Script plan is normally the cheapest plan that WellCare has, and as you see, it goes up to the premium for this plan is only 50 cents a month, so that's $6 for the year. And then it does give you the breakdown. As you see, it does not have dental, hearing, no vision. It's only your RX, which is your prescriptions. It gives you your plan's details about how much your deductible is. It's going to tell you what the deductible applies to. It's going to tell you how much your initial coverage limit is. That initial coverage limit is only meaning most plans is going to have 4 stages depending on the plan that you choose. You're going to have your deductible stage. Then once you meet your deductible, you'll go over into your initial coverage limit. And when you're in your initial coverage stage, that stage is based on what the plan pays, which is well care, and then what you pay out of pocket. So once both that combines to that $5,030, you're going to go over into the third stage, which is normally would be the I'm sorry, the coverage gap stage. In most points with the coverage gap stage, you do pay 25%. Oh, it didn't go over. Hold on, y'all. Oh, my bad. It went to a different screen. I wasn't even. Hold on. Let me redo it for y'all. My bad. Let me know if y'all see that now. Hey, OMG. How are you, Miss Thing? How you doing? Hey Teresa, how are you? Shonda, is it true some hospitals is going to stop accepting some Advantage plans? Miss Ann, I did hear that. I'm not sure exactly how true that is yet, but I did hear that. I definitely did. Hey D, how are you? Living My Life says, with Medicare and Medicaid, do you have some type of credit, bonus, or incentive where you can get free items like personal care items, etc.? Okay, so with that, Golden, Medicare Advantage is the only plan that I am aware of that offers like the um it's called a flex card that you can basically use it for whatever you want or to take care of like your over the counter medicines or the medications that are not covered through your plan. So that would be a Medicare Advantage plan. Standalone plans do not cover that. Nothing is on the screen. I'm sorry, y'all. I wasn't even paying attention. I was looking from the other screen, wasn't even paying attention to this. Hey, Norma. Uh, Thank you, Miss Lily. You gotta wait, poo poo. All right, so let me try to go back. All right. So again, as let me see, make sure we showing. Okay, so as y'all see, like this would be the well care. This is their cheapest plan. Again, it's only 50 cents per month. Their deductible was $545, and it only applied to the tier 3 through 6 medications. And then again, the initial coverage limit is where you will go into your initial coverage stage after you meet your deductible. In the initial coverage stage, that is only based on the only stage that is going to be based on what you pay and then what the plan pays until that reaches that $5,030. Again, you're gonna after that you'll go over into the coverage gap stage. Now, the coverage gap stage, that is where you would be paying 25% of the cost of your medications. Any medication you get, regardless if it's just a medication that only if you go and the doctor say, the pharmacy say that medication is only $1.30, you will pay 25% of that $1.30 until you reach this out of pocket cost of $8,000. That is what you will have to pay out of pocket for the entire year. The $8,000 you would pay out of pocket for the entire year. Once you reach that $8,000 out of pocket cost, then you go over into the last stage. And I know for this year it was the catastrophic stage. In the catastrophic stage, you actually have a $0 copay where you wouldn't pay anything for your medications. But keep in mind, Medicare plans, they only run from January 1st to December 31st. So come January 1st of 2025, your whole plan may change. The structure of the plan and everything definitely may change. Definitely may change. Uh, Hey, Miss Maritza, I do see you came in. Norman say, am I correct? That does not cover dental, vision, or hearing. Correct, Miss Norma. Correct. These are just the only plans that have the dental, vision, and hearing are Medicare Advantages plans. So standalone or original Medicare Part A, Part C, I'm sorry, Part A, Part B, and Part D, it has nothing to do with dental, hearing, or vision. It's just your hospital, your medical, and your prescriptions. Hold on, y'all. Please go in the living room. I am on live. Or get in your bed and lay down. No, you can get that tomorrow. It's too late, okay? Get in the bed and lay down and go watch TV. Okay. Let me see. D say, did anyone else notice how Humana made so many changes this year? Yes, all companies have made a whole lot of change. A whole lot of changes have definitely has definitely been done. Suke said, yes, I have an appointment with my insurance agent to discuss 2025. The only thing about that is most companies don't release the new information from 2025 until mid or late September for when open enrollment starts in October. So please understand, when you become eligible for Medicare, there is only certain times when you would be able to change your plan, period for
What?
the for enrolling into Medicare or switching for the new year. It would be October the 17th. Yep, it's October the 17th. No, it's October the 15th is when it starts, December the 7th. So that's your window to do your research on your plans and be able to switch to a new plan if you want to. Now, come November the 6th or November the 5th, and you haven't done that, that window is going to be closed. And that's when a lot of people are going to be um, getting denied or rejected for trying to switch their plan, and they're gonna have to be like where you're stuck. And that's when a lot of companies start getting in trouble, and a lot of members would start wanting to call Medicare and making complaints because they're unable to switch their plan because they're outside of that issue. So you definitely want to keep in mind the window that you do have to switch your plan. Okay, so say like if you are retiring. Now I know some people who retire jobs will continue to pay their insurance and everything. So it can work with you can have Medicare and have another insurance. So what would happen is Medicare would be your secondary, and then um Medicare would be no, your job would be primary and Medicare would be secondary. That means that your job will go first and then Medicare. Or you can have Medicare being your primary and then your job insurance being your secondary. So you can go hand in hand. Um, it says if you have other insurance who pays first, depending on the number of items, like if you're still working, this type of insurance you have, and if you have special situations like end stage renal disease. So you can definitely just to keep in mind that you can have your job insurance and still have this. Hey, Prince. Okay. So now I do just want to go into this here is the part this would be considered the Medicare supplement insurance, which is like I said earlier, would be considered Medigap. What is Medigap or the Medicare Supplement Insurance? It is extra insurance you can buy from a private company to help pay your share of out of pocket costs of original Medicare. Now, you must have original Medicare Part A, B to be eligible to get a Medigap plan. Trey say, yeah, it's supposed to be where Medicare is primary, Trey, but I have definitely seen working. Well, hell, I ain't with the company no more now, so it don't even matter. So working with WellCare, there has been times when they did let the the job insurance be primary. Now it does take a lot of work to get that done because you have to call this department, which is called the Coordination of Benefits Department, where they have to get all of that in the system. Papers and everything has to be signed, and it's a lot of work to go with it that route. Okay, so we did that part. So you have Medicare plan, which is the Medigap plan. This would be Medicare Plan F. Now, if you go and get a Medigap Plan F, that plan pays the Medicare Part B calendar year deductible, and it is only available if your 65th birthday. So this is one of the hold on, y'all. Oh my goodness. What? You already had Kool-Aid. Daily, y'all gotta wait. Can I finish my live, please? Thank you. Um, it says it's only available. So with the Part F, now this plan here, the Part F, it won't even be available for anyone that has a if you was born after January 1st, 2020. Or your 65th birthday wasn't before January the 1st, 2020. I'm sorry. So for to get the Part F plan, it was only available if your 65th birthday occurred before January the 1st, 2020, or you qualified for Medicare due to a disability before that time. And it covers 20% of medical costs not covered by Medicare, such as your deductibles and copay. Hey, Lisa B, at 65, if you have federal insurance, VA, and Medicare, does that make sense? Yes, yes, it does, Trey. It does. Mm-hmm. And then also, you have the Medicare Plan G, which is another part of the Medigap plan. Now, this plan, it covers most of the costs you'll have to pay for Medicare approved Medicare expenses, but does not cover. But it does not cover the Part B deductible or any services Medicare does not cover. So if you choose that you want to go ahead and get the Medigap plan Part G, just keep in mind that if your Part B plan, which is the plan that you have to go to the doctor, if that plan has a deductible, then you would have to pay that deductible. It doesn't, your that Part G plan would not cover that deductible for you, and it does not cover anything or any services that Medicare does not cover. So you want to definitely keep in mind and double check that any procedure or anything that you're getting is something that is covered under Medicare. They also have a Part K plan. Now, if you get a Medigap Plan K, that plan It pays 100% of the enrollee's Medicare coverage costs for the rest of the policy year after they meet the annual Part B deductible and the plan's annual maximum out of pocket limit of $7,060. So that means with the Part K plans, these plan is going to cover um, the rest of your policy year, but you will have to have met your Part B deductible, and you have had to have paid out of pocket for the year $7,060. So once you meet that out of pocket cost, that means for any services when you're going to the doctor or anything like that, once it reaches that $7,060, that Part K plan would go ahead and kick in and pay for everything 100%. Then you have another plan, which is the Medicare Plan L. And the Plan L pays, it helps pay for certain out of pocket expenses. It pays for 75% of the annual out of pocket limit. So if your out of pocket limit again was like that $7,060, then the Part L plan is going to pay 75% of that. So you would still be responsible for the other 25%. For Medicare members, including copay, co-insurances, and deductibles. Now let me say this, because with this plan, it did bring up another thing that I wanted to help a lot of people understand. So say like if you're going to the pharmacy and the pharmacy say you have a copay of, let's say, like $5. You know that you have been paying $5 for this medication for the last 6 months. That means that you have been making a copay. So then say after 6 months pass and you go back to the pharmacy to get your medication, and now the cost of the medication has went up, say from $5 to now you're may having to pay $50 for the medication, and the doctor tells you or the pharmacy tells you, most of the time the pharmacy is going to refer you back to your prescription drug plan, and they're going to basically say, well, you're paying 25, you're in probably, let's say, the coverage gap stage, and now you're paying 25% of the cost. Now that 25% of the cost is no copay, is like when they have that set for you. Co-insurance is when you are paying like a certain percentage. Okay. So I definitely did want to make sure I helped a lot of people understand that, because that have definitely, I've seen a lot of questions when dealing with that too. All right. So again, the Part M plan, that does help you cover certain out-of-pocket expenses for Medicare members, including your copay, co-insurance, and your deductibles. Um, Thank you, Suke. And then, of course, let me see, you went back green screen again. I did go then. All right, hold on. I don't even know why. Let me see. Go sit down and wait. Go. Go. All right. Hey, Ron. I do think I seen that you just came in. All right. So then the last plan that is going to be a part of your Medigap plan, they will have what is called the Part N plan. In your Part N plan, it covers the basic Medicare benefits, but does not cover your Part B deductible, co-pays for doctor visits. Thank you, Angel Mom, for that super chat. I definitely appreciate that. So it does not cover any of your co-pays or your deductible when you're going to the doctor. So none of that is covered, but having a part in plan, and to me, I just want to go over all of this with y'all, but I'm gonna be so truthful. Having a Medigap plan, it's really not useful. Um, so a lot they really don't push these plans a lot, but you do have, and I have seen where you have a lot of older individuals that do go and search for like a Medigap plan to cover those expenses and stuff, especially when it's dealing with their medications and helping them pay their Part B deductible and everything like that. Um, so definitely, I can't stress enough, y'all. And because let me see if I can pull up. Okay, yeah. So I'm gonna show y'all these Medicare Advantages plans, and to see if we can do a little deep dive or get a decent understanding with the Medicare Advantage plans. You welcome, Suke. Trey said, I'm glad I don't have any out of pocket costs, co-pays, medication, hospital stays, etc. This is too much. It's a lot, Trey. It really is. And that's why I wanted to at least go over a little of the information that I do know to at least try to bring some clarity, because I definitely know that this can be it can definitely be a lot. Okay, so this here, like with these Medicare Advantages plans, as y'all see that those plans, let me go back over here. Can y'all see the screen? I want to make sure it ain't went back green for nobody. So with the okay, thank you, Miss Lending. So with the Medicare Advantages plans, as I said earlier, those are like your HMO and your PPO plans. And those plans are the ones that would definitely Angel Mom said, when I turned 65, my job stopped paying for my medical as far as doctors, etc. However, my union pays for the medication, dental, foot, and eye for a lifetime. Yes, and I have heard that too. So definitely look into, and you want to make sure that you definitely let them know, Angel Mom, that they're still going to be covering some of your medication, so they can definitely put that in the system the correct way, because you don't want to go and be getting your medications and stuff, and then it turns out that now you have a copay because it's not in the system how it needs to be put. So you want to definitely make sure that everything is in the system correctly. So with the Medicare Advantages plans, as y'all see, again, those are the HMO, PPO plans. So, what does DSNS mean? That means that those are like dual plans, meaning that dual plans, like you're having more stuff with it. Like you have your dental, your hearing, your vision, you got your RX plan. And then this is where it breaks down to what you would be responsible for. This is why, to me, I wouldn't choose a Medicare Advantage plan, due to the simple fact of a lot of doctors and stuff, they don't deal, or they are not a part of their in network. So you would definitely have to look in their book, make sure that the doctor is in network. Because as you see, let me see if I can make it, if it give me something else. Let's see, view details. Hold on, y'all. Okay, so yeah. So here, as you see, it says dual access open. Hold on. Hold on. What is wrong now? You what? Okay, can you get in the bed? Well, go sit down. Deshaun, I want some, please. Please, I appreciate you. I just want some sausage and eggs, please. Sausage and eggs. I don't want yours. I don't want yours. Okay, so let me go here. Y'all know sometimes I just can't make it a whole. Um, I did not know that. I did not. I don't need that part. It's getting clearer as you speak. Okay, so I make sure I got everybody. Okay. So again, like as you see here with the Medicare Advantages plans, those does be the Part A, Part B, Part D. It does also include your to your vision, your hearing aids, and then it how much your deductible would be for your prescription drugs. It also tells you if your prescriptions are covered. It tells you your maximum out of pocket cost for in network doctors, as you see, is $8,850. And that is just for in network. And then say if you go to and if your doctors are out of network, as you see, that amount for an out of network doctor is even more. That is $13,300 in and out of network. And that's the maximum that you would pay. So that's why I say we definitely you want to search and look at different plans. It also, I did not want no tortilla. That's why I said I didn't want that. So it also gives you your Medicare covered medical benefits, like it covers like acupuncture. It gives you your home care services for like your is each year. So you want to look into all of this so you'll see exactly what would be included or covered under your HMO PPO plans. This is going to give you the breakdown of how much it costs. It's going to, like you see, this one have chiropractic services, dental services. You already had two popsicles today. It also they give you helping you with the training for your diabetic management, your diabetic supplies, and you see like the cost of it, how much it costs for labs for genetic testing, your doctor visit costs. So it'll break down and tell you exactly the cost of everything, what you can expect. It also is going to tell you about your medications, what you would pay for tier one for all the drugs that are on the formulary. You would pay this, and then it gives you your cost sharing. So it's a lot that you definitely want to go through and read. There was another one that I had seen because I think with this one. Okay, so let's say this one here. Because when, as you see, all of that changed now. It goes from you having a $0 premium to you got a $44.10 premium. Now you have that $240 deductible for medical. So that means when you go to the doctor, you got that $240 deductible. You don't pay no deductible on your prescriptions, and you don't pay, and your medications are covered. And then it tells you what your out-of-pocket costs for in-network. Most of these plans, they don't cover out-of-pocket, out-of-network. doctors. And again, it's going to break down and tell you what you would pay for different things. So definitely do your research. Um, go through it. If you have to, on a lot of this, if you look and see, let me go back to this screen. You would be able to compare more than one plan at one time, and it'll give you a breakdown of each one of them. As you see doing the breakdown here, it'll tell you the name and it gives you the out of pockets. And you just basically have to choose. Now, I would advise, and I think this is probably going to be some of the best information. Um, yes. That's what I was finna get to too. I was coming to that too, Trey Trey. I definitely would advise, and I'll tell anybody, if you're going to do this yourself, definitely make sure that you are definitely sitting down and you got your pen, you got your paper, that you can really crunch your numbers. Or if you're not that type of person, definitely find you an insurance agent, a Medicare broker or insurance agent that is going to be truthful with you and not just someone that is going to just try to throw you in a plan because they get an incentive for enrolling you in plans. So you want to definitely research that. And just like Trey did, just put in the chat, when you become eligible for Medicare, please, please enroll when you need to enroll. If you do not enroll, you are going to have what is called a late enrollment penalty. Now, that late enrollment penalty is going to follow you. When I say follow you, it's going to follow you as long as you are alive, as long as you are on Medicare. That penalty is going to follow you. And keep in mind, what they don't tell you is that penalty can change. It can change. It can change. It's not going to be a steady penalty because the formula that they use based on the I used to know the complete formula to break it down based on the base limit for like the base that they have. That formula can change, or the amount that they're doing can increase each year. So your penalties can go up for that late enrollment penalty. So I do just want to let you know. So it's not, it won't be the same always. Because this year that happened to a lot of members and that sent a whole frenzy. So you definitely want to keep in mind of that. You definitely want to enroll. Um, I do want to also put this out there for your prescription drug plans. When you're having like a standalone prescription drug plan, they are going to give you what is considered a 90-day grace period. Like if you miss paying your premium or something, if you miss paying your premium or anything for 90 days, they are definitely going to disenroll you from the plan. And then say from the day that they enroll you, you have 63 days to either one, get another plan, two, um, re-enroll or get back into the plan that you're in. Now, the only thing about that is some companies is not going to be easily to let you re-enroll once you have been disenrolled for failure to pay. You are going to have like special circumstances, like you was in the hospital, there was like a storm, your house burnt down, someone in your family died. If you call them and say, oh, I just forgot to pay my bill, they probably gonna hit you with, we've called you, we've sent you out letters, we've done everything like that. Say that happens in April, so now they won't re-enroll you. They won't you can't get another plan. Your 63 days is coming up and you can't re-enroll into another plan until October. And then even if you enroll into October, that plan won't start until January. So now you have went May, June, July, August, September, October, November, December. You have 8 months of not having a plan. So now you're going to have a late enrollment penalty for those 8 months. Now, keep in mind the late enrollment penalty may be nothing. It may be like $3, $4. But keep him that adds up because this is going to be every month. Every month that you pay this, every month, every month. I've seen like on the new plan, it was a $0 copay. So a member went a whole year or so without having a plan because they wasn't sick. They just didn't need it. They felt like it was pointless for them to have it. But they went like over 2 years without having a plan. Do you know how much they ended up having to pay for a late enrollment penalty? They late enrollment penalty was like $60 when the $60 each month because of that late enrollment penalty of them missing that period or not paying their premium and they got turned. So you definitely want to keep in mind and keep up with that because that's definitely going to be something that is definitely important. Okay. All right. So y'all, I have came to an hour. I am definitely about to get ready to hop up off of here. If anybody got some other questions or whatever, definitely just put them under this video. I'll definitely look it up, get the answer for y'all, come back, do another live. But I definitely did want to bring this because I have been talking for a minute saying that I was going to go ahead and get this live done and get this information out to y'all. So I definitely wanted to go ahead and do that tonight. And thank you, Trey Trey. And I definitely want to thank each and every last one of y'all that have been here with me for this hour. Those who have just came in, you're welcome. Miss Golden. Those of you who just came in, catch the replay. If y'all want to drop your girl a couple of cash apps for the information, cash app is gonna be $ mom of free boy. I definitely appreciate each and every last one of y'all, and I would definitely get with y'all later with more information as I come up with some. Once I get some more information about new plans and stuff, I'll definitely come and break that down to y'all too. You're welcome in another glow. You're welcome, Miss Norma. If y'all got some stuff that y'all want me to look up and get some more information for y'all, definitely let me know. Because I actually like being able to spread a little information with y'all. I think I like going this route better than being out here arguing and fussing with everybody. But on that note, you guys and you ladies, I definitely want to I'll put it in the chat. Hold on, Norma. Uh-oh. Y'all, I can't type for nothing tonight. All right. All right, so I definitely want to thank y'all for coming and talking with me tonight. And I would definitely talk to each and last one of y'all later.